Good afternoon, everybody. Doug McGowen with the City of Memphis and the Memphis and Shelby County Joint Task Force, joined today by Dr. Christine Taylor with the Health Department. I'll start with just some brief comments about testing and vaccination, then turn it over to Dr. Taylor for a full report. On the testing front, it's something adding capacity is something we've talked about for the last couple of weeks. I'm pleased to report that through the additional capacity at the public testing sites, we have seen pretty dramatic drops in wait times. Typically there is a wait early in the morning as people queue up, but after about the first hour, that wait time has come down pretty dramatically. We've added an extra lane at Poplar Healthcare out at Hacks Cross, added an extra lane of throughput at the Lamar Avenue site, which is on RKS Commercial Cove, and we've added a brand new testing site at the South 3rd Street Christ Community Healthcare systems, and we're very pleased that we're offering that testing to everyone because it's important that you know your status. We'll continue to monitor the situation, and if we need to add additional capacity, we will work very hard to do so. But for right now, we believe that we are meeting the need that we're seeing in the community. On the vaccination front, lots of the work that we are doing is getting information to people, and as you know, we have a door-to-door team. Last week, in honor of 901 Day, they actually knocked on 1,901 doors. Had to get that extra one in for 901 Day. And this week so far they've knocked on almost 700 doors, and those are in the zip codes where people have the most hesitancy or the most demonstrated hesitancy. That is added to by phone calls from our partners at the University of Memphis and UMRF, who have placed now more than 75,000 phone calls, spoken with 46,000 people, giving them information about testing, vaccines, and other treatment protocols. All that has resulted in our community delivering more than 860,000 vaccinations. That means that we're approaching 51% of our population has received at least one vaccination, and more than 40% now, or 300 and almost 80,000 people now are fully vaccinated in our community. Still lower than we want it to be, but we are making progress, and there has been somewhat of an uptick. Now, we've expanded the hours at our public vaccination drive-through site at the Pipkin building in order to accommodate that increased flow. The Pipkin building is open every day from Tuesday to Friday from 9 a.m. to 6 p.m. And on Saturdays, it's open from 9 a.m. to 1 p.m. Now, there are several notable exceptions, and I want to make sure that everybody is aware of this. The Pipkin building is obviously located at Liberty Park, which is home of the Liberty Bowl. And when there are home football games for the Memphis Tigers or the Southern Heritage Classic, that's very exciting and coming up this weekend, we will not be able to offer vaccinations at the Pipkin building. So this coming Saturday, and on every Saturday when there is a Tigers home football game, the Pipkin building will not be offering vaccinations on a Saturday of a home game. So please, before you drive out, just double check with the schedule to make sure it's going to be open. Now, there is really no update on the booster vaccines. As you know, today, people who are immunocompromised may go get that booster at the Pipkin site or any site of their choosing. We anticipate, though, that approval will come in the next few weeks, and so we are ready for that. The Pipkin building, that's why they're expanding their hours now. We are working with our partners in Germantown and Collierville to stand up the site that was at the Germantown Baptist Church. More details to follow on that. And there is also a possibility of a site in the Whitehaven area on select days as the demand comes along. So look for more announcements on that when we get approval to do boosters, and we will be putting a schedule out for the days that they will operate. We'll also likely have a sign-up program like we had done before, because we anticipate there will be pretty large demand, and we don't want people to have to wait for hours just to get their booster, but rather to be able to schedule when they receive that. So look for more information on that. Perhaps next week we'll have a little more clarity on when we might get that approval. So with that, I'll stop, and I'll turn it over to Dr. Taylor for her comments.
Good afternoon, everyone. We're going to run through some slides, talk a little bit about what's going on with the COVID landscape in the community, and then open it up for questions. So first slide. today, new reported cases 423. Of note, yesterday, newly reported cases was at 1,295. The 7-day average of cases per day as of today is 733. Next slide. The COVID test positivity rate is currently 23.4%. That's up from 19.3% last week. The effective reproductive number has come down just a bit more to 1. Next slide. The percent of active pediatric cases among all of the cases is 38.3%. And as you can see from this slide, active cases in the 0 to 17-year-old group have continued to rise, with all other age groups continuing to fall. Next slide. This slide shows the heat map by zip code for active cases. Zip codes with darker areas represent areas with more active cases currently. And active cases are cases that have been identified in the last 14 days. Next slide. This slide shows a comparison similar to last week of the active cases on the left by zip code, and then the percent of the population vaccinated on the right. Next slide. This slide shows where we are with the population as far as vaccine uptake. Right now, we are still seeing a modest increase in folks getting vaccinated. Next slide. This is a slide that's familiar to most. It shows that of our Shelby County residents that have received at least one dose, we are at 50.3% of the population. And residents that have completed the complete series, we are at 40.7% of the population. Next slide. And this slide is different in that it shows some of the places where you can receive a monoclonal antibody treatment. So remember that in addition to vaccines, we encourage residents who are COVID-19 positive and are at high risk for severe illness from COVID-19 to seek monoclonal antibody treatments. These treatments are proven to help reduce severe illnesses for individuals considered high risk, keeping more people out of hospitals. And a few examples of high risk are older age groups, women who are pregnant, diabetics, people who have immunocompromising conditions, and folks who have cardiovascular disease. All of these things, in addition to not being fully vaccinated, put you in a higher risk category. Remember that COVID-19 is still with us. And with that, you have to remember that because it's with us, even though we are tired, even though it's been an 18-month marathon, COVID is not done with us. And we have to do everything we can to protect ourselves. We have to wear our masks over our nose and mouth, particularly when we're in indoor public spaces, but also when we're in outdoor spaces that make social distancing difficult, and where we know we may be in crowded spaces where people's vaccination status is unknown to us. Remember that right now in our community, we still have a high case rate, and at the same time, we have a relatively low vaccination rate, and that means we really need to be paying attention to what our level of risk is every time we go out. And with that, I'll open it up for questions.
Fred Broders, Local 24.
Hi, good afternoon, Dr. Taylor. Since last week, I know we haven't talked to you since last Thursday on these briefings. Has anything changed in terms of the next directive of considerations of any additional restrictions, including potential large outdoor gatherings? And I'm a follow-up.
Great question. So nothing has changed as of late. And I'm glad you asked that question because that's a great question. Remember, we in Shelby County have one of the most aggressive approaches from across the state. We have instituted a universal mask mandate in our K through 12 schools, daycares, and pre-Ks, and we also have a universal mask mandate in our indoor public spaces. And so when you talk about the measures that we've already taken, we are more aggressive than many of our counterparts across the state of Tennessee. The other thing to remember is, at least for Shelby County, in old days you would hear politicians talking about people voting with their feet. Well, right now, a lot of Shelby County residents are voting with their feet in different ways. They're choosing whether to get vaccinated or to remain unvaccinated. They're choosing what establishments to go to and how often to go to them. And they're choosing whether to go to large events or not based on what they believe their level of risk is. Me, Chief McGowen, others that have gotten in front of this podium have explained what it means to vote with your feet, essentially, what it means to assess your level of risk. Given the data and where we are in our community, we know that we have a high infection rate, and we know that we have a relatively low vaccination rate. And all those things put together is what we're putting out to help people to understand what their level of risk is and how they do want to vote with their feet. Right now, we're not putting any other measures in place. It doesn't matter if it's a large event or a restaurant. We're not putting any other measures in place right now, but nothing is off the table.
Thanks, Dr. Taylor. And as a follow-up, my follow-up to Chief McGowen, I'm glad to hear that the lanes being asked testing and off the top you had mentioned. And I'm not sure if this is entirely in your purviews with the task force, but we're hearing some issues with appointment issues for same-day rapid testing. Is there anything you can express with that situation, Doug?
We have heard the same thing, Brad, and I think largely this is about the the availability of those rapid tests. So that is something we're working on. We may not be able to control it completely, but it is something we have heard about, and I think it's just generally a production issue with those rapid tests. So stand by. I think it's a national issue, and we'll see if we can get any traction on that.
Abigail Warren, Daily Memphian.
Hi, thanks for taking our questions this afternoon. My first question is for Dr. Taylor. We've been under a mask mandate for about 3 weeks now universally. Obviously, it's been in schools for about a month, but the numbers are continuing to increase. So is the mask mandate here to stay, and do you think it's working? And then I'll have a follow-up.
Great question. So for right now, the current health order does not expire until the end of September. At that point, we will reevaluate based on what's going on with the numbers and decide if the mask mandate needs to continue.
Okay. And then the other is, under the temporary restraining order that was issued last week, Shelby County was ordered to enforce its directives. What does that look like in general and specifically when it comes to masking?
So we were ordered in the schools to maintain our directives, and what that looks like is what we've already been doing. We have a number of contact tracers on our team, a number of health investigators, and we are deploying those folks out. We were doing that before the injunction, and we continue to do that. We continue to contact cases, and we continue to maintain contact tracing of contacts as much as possible. And that includes several different methods. So sometimes we're texting contacts. Sometimes we are cold calling them if we can get in touch with them. And of course, we're emailing. And so we're employing every method we can to get in touch with cases and contacts to make sure that we're showing people how to stay safe and how to keep the community safe by having those folks either isolate if they're cases or quarantine if they're contacts.
Dominique Dillon, Fox 13.
Good afternoon. My question is, with Labor Day weekend wrapping up and then big events this weekend and in the near future, what can we expect moving forward? How concerned should people be with a rise in COVID cases? Do you see a surge, and how could it affect hospitals that are already strained?
Great question. So I know you all have seen me and Chief McGowen stand up here and give you many points of data about how folks can protect themselves. And we've also talked about the arc of how these things go. So normally, if in surges past, what we've seen is this, and the science leads us here every time. So first, we see an increase in cases, then we see an increase in hospitalizations, and then we see an increase in deaths. And every surge has followed that pattern. Now, what's to come over the coming weekends? What I hope is that people will continue to protect themselves to the fullest extent that they can. What does that look like? That looks like wearing your mask even when you're outdoors, when you know you cannot safely distance, and when you know you're going to be in a crowded situation, whether you're in a crowded bar, whether you're at a crowded event, whether you're just at the park and it's crowded. So we know that that's a layer of protection that you can give yourself. But what we are really encouraging is that folks continue to go out and get vaccinated. If you have not been vaccinated and you are 12 years of age or older, that should be what everyone in Shelby County should be looking to do, not only to protect themselves and their families, but also to protect the kids who cannot vote with their feet, like I was discussing earlier, who do not have the option to get away from someone all the time, regardless of vaccination status. Those folks are the people that we are really trying to protect in the community, and those kids are the ones that we see the cases rising most rapidly. So it's really, really important that everybody understand we're not shutting anything down right now. The health order stands as it is, but we are encouraging you, stressing, imploring that you continue to protect yourselves as much as possible.
Was there a follow-up?
No, thank you.
Absolutely.
I just wanted to follow up because I think it's a really good question. And so I think of this pretty simply. Our hospitals are very full. What they cannot afford is more people seeking treatment for the COVID condition. And so there's really several parts of this, and every one of us has our role to play. I think of it in terms of prevention, protection, prevention, protection, intervention, and then treatment. And what I mean by that is we can all prevent the disease by not putting ourselves in a position where we can come into contact with it. You talked about large crowds. You can prevent your exposure to it by not going to places where you believe the COVID virus could present a risk to you. Protection, two parts. Protect yourself, protect your family and your coworkers. Protecting yourself means wearing the mask if you are in a place where you think you can be exposed, and getting a vaccination, which will build your antibodies to help fight off a potential infection. Protecting your family and your coworkers means getting a test regularly, whether you are symptomatic or not, so that you know your status early and so that you can protect other people by not exposing them. Preventing it by not being putting yourself in a position, protecting yourself by wearing a mask and getting a vaccine, protecting others by getting regular tests. The intervention component is if you do believe you've been exposed or you do think you're symptomatic, immediately seeking medical intervention with your primary care provider so they can provide you with the appropriate course of care. And as Dr. Taylor just talked about, sometimes that means monoclonal antibody treatment. That is an intervention that will keep you from having to do the final thing, which is seek treatment in the hospital for the COVID disease. That's our role, preventing our exposure, protecting ourselves and others through masking, vaccination, and regular testing, seeking immediate medical intervention, not ignoring symptoms, and getting the appropriate level of care, which could include monoclonal antibodies if you do become positive, and then treatment. There are so many things upstream that we can do together to prevent our hospitals from seeing the enormity of the cases and the deaths that ultimately result from that.
Hannah Grabenstein, MLK 50.
Good afternoon. My question actually is about monoclonal antibodies. My understanding is that the FDA approved prophylactic monoclonal antibodies for people who are unvaccinated and have been exposed if they have not tested positive, or who are vaccinated and are at high risk for any number of reasons. And I'm wondering, are there centers here that are offering prophylactic or, protective monoclonal antibodies, even if somebody hasn't yet tested positive?
I'll let the doctor answer the question about that. Dr. Taylor, she's the expert, not me, but there are places that are offering that under those conditions. And you said it very well, and it bears repeating. So, Dr. Taylor, do you want to talk about that?
So, yes, Hannah, you're exactly right. That has been approved. We do have centers offering that. And it is a consideration for people who are feeling symptomatic, maybe worried that they have been exposed or already know that they've been exposed. It's just another in the line of things that we have in our toolkit to fight against COVID-19. But remember, before you ever get there, we have other things in place that hopefully will keep you from having to go there, but it is another one of those stopgap measures to hopefully keep more people out of the hospital.
Thank you. My follow-up is about vaccines. I think I heard you say that vaccine uptake is increasing, but I'm looking at the 7-day average right now, and it looks like it's a lot lower than it was, at the end of August when we were averaging over 2,000 a day, and now we're close to 1,200 a day. Is there an uptick that I'm missing, or is vaccine uptake actually decreasing? And then also, I just wanted to check in and see if the dashboard was going to be updated, because it looks like it's down for the second day in a row.
Great. So 2 great questions. First question is fabulous. The slide that I put up showed it by age group. So across each age group, we are seeing still some modest uptake, but you are right. Overall, the numbers have dropped a bit. As far as the website being down, we are in touch with the vendor who actually does those numbers, and we should have that back up and running by the close of business today. If not, I'll get back with you with an update.
Go back to Brad Broders with Local 24.
Thanks all for circling back to me. I forgot to answer, and thanks for having another opportunity. Do you all have the updated hospital numbers? I know last week it was 721. I didn't know if you all had an update today.
Brad, I will give you I don't have the sheet in front of me, but as of today, the number I recall from this morning is 641 hospitalized, including 190 who are in the ICU, and about 160 of those are ventilated. That is the approximate number from this morning.
Abigail Warren, Daily Memphian.
I wanted to see if we could possibly, I appreciate that y'all are sending the pediatric numbers. Could we also get the numbers more frequently of how many of those kids are in the hospital? And could you tell us what that is, Chief McGowen? Do you have those numbers?
We do have the number, and now I'm trying to draw from my memory. I believe we had about 30 cases in the hospital the last time. Dr. Taylor, do you remember where it stands today?
I believe 27 cases
Okay.
and 7 in the ICU.
27 cases and 7 in the ICU. So we have been hovering around that 30 total in the pediatric cases in the hospital. So it's stayed relatively steady state.
Back to Hannah Grabenstein, MLK 50.
Thanks again. I was just looking at the cases by specimen collection date, and it looks like they started to drop since August 24th, and I'm wondering, is that an artifact of Labor Day, or have we really started to turn the corner?
Well, again, Dr. Taylor may have some comments on that, but we really, we look at that 7-day case average as kind of an indicator, because it normalizes the highs and lows. You heard Dr. Taylor talk about we had 426 newly reported cases today, but 1,200 yesterday. So it really does go up and down, and we're looking for that continuous trend to come down. So it certainly is not dropping precipitously enough for us to be excited at all. We are still in the thick of this fight, and the numbers are all way too high. The only promising indicator that I really have heard is that the R0 is now just above 1. We really need to get that down below 1. Dr. Taylor, anything you want to add to that? Okay.
Those are all of our questions today. Are there any closing messages?
I'll just repeat what I said. We all have a role to play, preventing our exposure to the disease, protecting ourselves and our family members through masking and vaccination, and then protecting others by getting a test regularly so that you know your status, and then getting that intervention treatment if you do know that you're exposed and or become symptomatic early. I've heard way too many stories about people trying to ignore the fact or denying the fact that what they have could be COVID and coming to work or going to school anyway. We no longer have that luxury. Just on a personal note, I was always one of those guys that's going to tough it out and come to work under any circumstances. I'm not missing work because I'm sick. Unfortunately, that's a pretty selfish position to take today, and it unnecessarily exposes other people to the dangers of this. You may be healthy and you may be robust and you may be immune to the effects of COVID besides mild symptoms, but other people among us are not, and taking that position puts them unnecessarily at risk. So please think about the body of the community here, that we are all trying to come together to get through this and do what you need to do to protect other people. That's the right thing to do as Memphians, and we have come together in so many other ways to surmount so many other hurdles, and I know we can do this too if we come together and think about each other. Thank you.
Thanks, everyone. We'll see you back here next week.